Kevin Haig.
Thank you, Mr. Speaker. I want to begin by perhaps learning from Paul Hutchison's experience and saying that the Green Party understands the reasons for extraordinary urgency on this occasion and supports it. And it will be my great pleasure to support this bill. And it's an honour, in fact, to speak in the same debate with the Honourable Tariana Turia. Minister, congratulations. And also with the Honourable Annette King, who also has played a really important role in this country's progress against smoking. Other speakers have commented on the size of this problem. You know, we're talking about the single greatest cause of premature death in this country, somewhere between 4,500 and 5,000 unnecessary deaths each year, and I take the point that Ruth Dyson made also about the increased morbidity associated with smoking also. I, of course, live on the West Coast and had some responsibility for West Coast Health Services, and so let me report that the West Coast has one of the highest rates of cigarette smoking in New Zealand. And for me, responsible for the West Coast Health Services, constant frustration that we had so many people dying unnecessary premature deaths, and so much of our resource in health services was needing to be invested in trying to care for those people, and was therefore unable to be used for other purposes. So the West Coast, I'm sure, will be welcoming this move. I also want to comment a little bit about inequalities. The incidence of cigarette smoking is a major reflection of inequalities in New Zealand. Overall, according to the data we had from last year, our smoking rate amongst adults is 21%. But for Māori, it's over 45%. For Pacific people, it's over 31%. That is a major reflection of inequalities in this country. Further, sir, just in relation to socioeconomic status, people in the most deprived areas are more than 1.5 times as likely to be smokers as those in the least deprived areas. So smoking is a major reflection of socioeconomic and ethnic gradients in this country. There's some good news. The good news is that overall smoking rates are declining. Consumption of tobacco products reduced by a third in that period from 1997 to 2008, which is some of the years that the Honourable Annette King referred to. That's good news. And so also in 2008, half of 15 to 19-year-olds had never smoked, had never tried smoking. And that was a very significant increase on the 39% in that category just 2 years earlier in 2006. So we're making some really good progress. So now, sir, is the time to actually ramp up our momentum, not to actually ease off. And I commend the Minister for her initiative in this area. We're also learning a lot about what makes a difference, about how to do this better and better. And certainly nicotine replacement therapy, as Honourable Annette King's just referred to, is one of those things. On average, a person will make, I think, 7 attempts to quit before they're successful. But each of those attempts is twice as likely to succeed if it's used with nicotine replacement therapy. So that's a really important piece of information. In relation to this bill, sir, we know that price is an effective mechanism in changing demand. And we've referred on several occasions now to the 2000 increase. Paul Hutchison referred to it, Annette King referred to it. In 2000, the excise tax was increased by 20% and smoking rates dropped by 18%. So that was a very clear demonstration of that link. Increasing price is effective in reducing demand. But as Annette King's also talked about, we know that there are other things that would also be successful. And I certainly look forward to this House debating a comprehensive range of measures to effect the biggest hit that we can possibly make in tobacco control. Display of tobacco products clearly is an issue that would make a significant difference. The outlets at which tobacco products are available also makes a difference. Extension of the Smoke-Free Environments Act into other areas. These are all areas that would make a significant difference and that we should be debating and pursuing. The content of cigarettes, interestingly, is an area that actually could make a significant difference. But I want to particularly pick up on Paul Hutchison's reference to the Dole and Hill study from, I think, 1956, wasn't it, that made that conclusive link between cigarette smoking and lung cancer. Because that was effectively, for our modern era, the birth of a health education approach to trying to deal with some of the health problems that we face. It seemed kind of obvious. If a behaviour is the cause of ill health, and that there are other behaviours that are available to a person, then actually if we provide more information about the positives and negatives of particular sources, so more information, more education, then people will choose the healthier option. That's the theory, and it's completely wrong. It actually kind of works for those who have the greatest sense of control of over their own lives. And certainly since 1956, you'll have seen that in the higher socioeconomic grades and amongst Pākehā New Zealanders, for example, smoking rates have declined extremely substantially, but less so amongst Māori, less so amongst Pacific, less so amongst those who are most socioeconomically deprived. Why is that? It's because actually this behaviour is not really a choice, as with so many of our behaviours. Health status reflects a couple of things. It reflects the level of empowerment of a particular community, and it reflects the kind of environment that surrounds that community. And health promotion says, actually, if we want to make a difference, that we need to empower communities, and especially those who are most deprived, and we need to create environments that facilitate better health outcomes. And we do that through community development. We do it through creating healthy public policy, such as this bill. We do it through personal skills and reorienting health services. And so I look forward to that being included in our comprehensive approach. The other point here to make is that while we are adopting this approach to tobacco in this House today, and it seems we might have at least a near consensus on that point, while we're adopting this approach on this issue, tobacco is one of, I guess, three big issues that have a really huge effect on New Zealanders' health status. The other two, sir, that I draw attention to are the kinds of foods that we eat and the exercise that we have, and they contribute to cardiovascular disease and cancer and many other causes of ill health and death. And the other, sir, is alcohol. And so it's an extreme irony to me that in the House today we're debating a systematic approach of increasing the excise tax on tobacco because we know that will have an effect on tobacco consumption. We know it will improve New Zealanders' health status. On the day that we've had the Minister of Justice ruling out excise tax increases on alcohol. Excise tax increases that we know would reduce alcohol consumption, that we know would improve New Zealanders' health status. There's an irony there. And I hope that as a Parliament we're able to learn from this case study, we're able to learn and extend that approach of regulation, a regulatory approach to improving health to those other areas, because if we can learn, then the gains that we can make are indeed extremely substantial. Congratulations again to the Minister and to the Government. The Green Party will support the bill.
Ko Rahui Kātani.
Thank you, Mr Speaker. In the 2008 election campaign, there was one